I love how much we continue to be asked here at ESMO 2025 in Berlin about the Himalaya study. It's a great study we're very proud of, and if anything, this was the add-on of the anti-CTLA-4 Tremelimumab plus the anti-PD-L1 Durvalumab, and great benefit. Improvement in survival by the median was about 16.43 months versus 13 for Sorafenib as a standard of care therapy. But as we all know, there's a time for priming of the T cells, and that priming will actually lead to those kind of what we call long tails on the curves, and that continued separation with the Kaplan-Meier curves. It's really wonderful, and we really continue to celebrate the recent publication that we have and colleagues and co-authors from the Himalaya study in the Journal of Hepatology about the 5-year survival. Numbers that admittedly I still can't really fathom in my mind about advanced liver cancer with 5-year survival. And guess what? Patient received only single dose of Tremelimumab, one single dose of Tremelimumab, and continued repeated therapy of Durvalumab once a month. They have 20% survival at 5 years. At 5 years. So in other words, 1 in 5 patients will be alive at 5 years. And this was compared to about close to about 10% or so for the Sorafenib. So clearly that dose, remember, we give it only once, that was given 5 years ago, it still has an impact to really benefit patients. And to that matter, we know very well Durvalumab by itself, probably a tad closer to the Sorafenib, about 13 or so, but definitely the standout of the anti-CTLA-4 plus anti-PD-L1 really fascinated. So we were fascinated by it when we looked at the 5-year survival for the Himalaya study, which is a great standard of care therapy now for patients with liver cancer.